I'm on my way to work. Medstar Hospital. 12 hours. It's gonna be a wonderful shift. Hello, my name is Shalom. I'm a registered nurse. I've been working with Medstar Health for over 35 years. I've been a nurse for actually 27 years. I love my job. I think anyone who's interested in going into nursing, it's a great profession, very rewarding. If you ever wonder how I got into nursing, I'm not one of those people that woke up one day and was like, oh, I want to be a nurse. No. Actually, funny story behind that. I was actually a patient in a hospital, and had a nurse, and she was very mean. She was very mean to me. And long story short, I just said to myself when I left there that I'm gonna go to school and become a nurse, because I do not want people to have to deal with people like her. Believe it or not, I ended up going to nursing school. And while I was there waiting for test results at that same hospital, I went up to human resources and applied for a job. And I was hired. I was hired as a secretary, and I worked for the same company, and that was over 35 years ago. So currently, I am a nursing supervisor. I've been a nursing supervisor for over 16 years. When I worked clinically, like I said, take care of patients, I was an emergency room nurse. And I did that for 10 years. I loved it, and I never thought I would leave it. But then an opportunity came for me to be a nursing supervisor, and I took it, and I've been doing that for 16 years. I usually work a night shift on the weekend, so I'm responsible for the entire hospital by myself. I'm the only administrator in the hospital, so I'm responsible for issues with patients, staff, families, emergencies, anything that comes up. I'm the one they call. But as I said, I have no regrets. I love my job. I would highly recommend anything in the healthcare field. It's very rewarding. It's wonderful taking care of people. So when COVID hit, it was a very scary time because, of course, as we all know, people were losing their lives to COVID. And as healthcare workers, we had to be here. We had people on the front line. It was very scary. Fortunately, as far as I know, I never contracted COVID. Of course, everyone had to wear masks. When it first hit, the hospitals were very empty. We had a very unusually low census. Like usually our census is between maybe 150 to 200 patients during a 12-hour shift. But I mean, our census was as low as maybe like 30 something patients. I mean, there were people, as in, the world has shut down, the United States has shut down, so people were not leaving their houses. And people were not on the road. So I will tell you, coming to work and going home was a very nice commute because there was nobody on the road but us, healthcare workers. But it was very scary. And then once things started to open up and people started contracting COVID, and we just had units in the hospital that were full of COVID patients. And not just that, but the associates, employees were contracting COVID, either from their families or from the patients. And although they were using PPE to protect themselves, there were times when we thought people didn't have COVID, but they tested positive later, and people were taking care of them and still ended up developing COVID because they weren't using the PPE because they thought the patients were COVID negative. But it was a very scary time. Actually, a lot of healthcare workers left the profession. A lot of nurses left the profession during COVID. And a lot of people also realized that nursing was not for them because they were not willing to risk their lives every day to come to work to take care of patients. And they decided this is not a profession for them. And those of us that are kind of they're older and more seasoned in the profession, when COVID was really rampant, we were saying, this is what we went to school for. This is the type of work that we went to school to take care of patients who are really sick.